Hello everyone, I am Miss Chantel Carter and I am going to be talking to you today about the care of the pregnant woman. We're going to cover chapters 13 through 15 and I'm going to go over some of the learning objectives as well as some of the key points that I want for you to take away from this lecture. All of this information can be found in your PowerPoints, so feel free to look through them. I do advise looking at the PowerPoints before coming to class and then hearing the lecture, because I will give some examples that you will see in practice, as well as things that will help you kind of process and connect the dots. And then I'll hit on some key points of the topics as well. Because it's so many chapters, of course, there are a lot of learning objectives involved, so please just bear with me. I do find it very exciting though, so and there are things that you will see in the clinical setting, so just look at it from that lens. All right, and again, if you have any questions or concerns, please put it in the forum on Moodle, and my office hours will be posted. I'm on the 3rd floor in the nursing building. Feel free to contact me or stop by. I'm more than likely going to be there. But okay, so care of the pregnant woman. So some of our learning objectives, we're going to get into the anatomy and physiology of the pregnant woman. So you may wonder, how does this differ from a woman who is just not pregnant? And there's so many physiological changes that occur during pregnancy. There's a lot of blood volume to support the perfusion and the oxygenation of the baby. So there are many, almost every organ system is changed because of pregnancy. So we will go through that, through all of those systems in lecture. Then we're also going to discuss, different tests that are involved to test for pregnancy, as well as what is it like when someone thinks they're pregnant, right? Like there are those moments, after intercourse where you're just not sure, and there are some probable signs, some presumptive signs, and then there are definite positive signs of pregnancy. So we will go through those as well. I'm looking at the objectives right now as I discuss them with you. So we're also going to evaluate prenatal care. Whenever you go to the doctor for the first time after after confirming your pregnancy, what does that look like? Every single woman has to pretty much go through the same process if they come into the clinical setting. So we do the same lab work, we do the same head-to-toe assessment, we check for immunizations, we check for STIs, we do a head-to-toe. So we also check for genetic tests, right? There could be any sort of anomaly or abnormality within the family history that can show up in the fetus. We want to be prepared for these things. So we definitely go through a thorough health history with the mother and their family members. So that's important here too. So as the nurse, we will intervene if we do find any abnormalities present or any likeliness of disease. We will intervene as far as safety. When we're talking about, let's say, if someone does have an STI, we do want to treat immediately. So that's all a part of taking that health history, right? And that's just one example, but we go through everything. We also get the mother involved, get the family involved. Like, are you excited? Congratulations. My grandmother is always like, children are a blessing. So I always say congratulations, and I'm so excited for you because children are a blessing. So I definitely tell them, I'm excited for you. And then what do you want? How do you want to deliver this baby? Like, what's your idea of ideal pregnancy, and help you come up with like a plan of care, and just being there and letting them talk through their fears, their concerns. Do they have any history of any problems in pregnancy before? So I definitely get them to talk to me and just what some of their expectations are, and what availability they have, what options are available for them to have a birth, right? So now we can do water births, we can do home births, we can do, there is the clinical setting, the hospital birth, which is where we will primarily focus our attention. But those are some concerns that the mothers may have for some of their desires, right? So we want to be sure that they can talk through all of those things. Nutrition. Oh my gosh, we're definitely going to talk about nutrition. Like, what are they eating? You can't just overstuff yourself just because you're pregnant, you know, because after the baby comes, you do have to lose that weight. And then there are a lot of health concerns if you do gain a lot of weight during pregnancy, right? Like, those risks are still present. There's still diabetes, high blood pressure. Those are things that we don't forget about throughout the pregnancy and then postpartum period. So we do talk about nutrition. And then we also mention the nutrition as far as the baby too. Like, what is the baby gonna get? Because whatever mom eats, baby's eating as well. So we do wanna be concerned about that. So we do talk about healthy nutritional options, and then also being culturally aware, right? So not everyone eats the same. Not everyone has the same opportunity or access. So we do have to be very respectful as nurses and very open to figuring out a new way that's the healthier way. And it may not be what you may want to do, but it may be something that someone else culturally does. So we cannot shy away from that or turn our noses up at it. We have to be very open and non-judgmental and accepting so that we can establish this really good relationship. So that goes down to communicating, right? Communicating with your patients too. There are going to be cultural barriers because we're dealing with, you know, Louisiana. There's so many different rich cultures here, right? Such a diverse community. So understanding their needs, everyone's needs, and being there and being that resource for them, right? You want them to come to you. You want to know the answers and know how to help them. So so those are definitely like kind of the key things we're going to hit on today during our lecture. And then, and like I said, it's 3 chapters, but let's now look at just some of the key points that I want for you to remember. So in going to chapter 13, the key points, of course, are going to be maternal anatomy and physiology, and then the changes that occur, particularly to the blood volume. We do go heavily into cardiovascular diseases later on, but we do, this is kind of like that introduction to it here, but knowing that there's an increase in blood volume, there's increase in hormones, these are all things that we find in pregnancy. Another key thing is because of that increase in blood volume, you get an increase in heart rate, and then you also get a kind of a hypercoagulability state. So because of that increased risk of a thrombus, you know, that's concerning because of this hypercoagulability that's going on within the pregnant patient. So those are things that we look for. The respiratory rate also changes during pregnancy. The GI tract, we have a lot of heartburn and constipation, so that also ties into nutrition. And then we also, because of that increased blood volume and blood flow, we then have the renal system, right? Because that has to take care of all of that fluid and processing out. So there are some risk and changes there too. So again, it just goes down to like those systems, right? All of the systems that are changing within the body. So, and we will further discuss this in class, but these are just those key points from chapter 13 that are important. All right, so then when we're going into chapter 14, some of those key points are just the family aspect, right? And again, when you're having these interviews, when you're going into the clinical setting, normally there's a bunch of family members present. So we want them involved. We want to feel like we're part of their family too, because we're going to be a part of this birthing experience. So knowing what needs the family has is key, right? So we want to definitely discuss that with them, as well as educate them about what labs we're going to be doing, what tests we're going to do, just so that they're familiar with it and they're not caught off guard, you know, because we're going to do a lot of blood work here, a lot of tests. So making sure to do a lot of teaching and educating about the tests and why we're doing those tests. That is really, really key. So it's one thing to say, oh, I'm just going to draw your blood, right? And I mean, most people are going to say, well, why are you drawing my blood? Like, what is this for? as a nurse, you have to have that answer. So it's not just, oh, it's a CBC. Why do I need a CBC? Well, just from what I mentioned earlier, there's an increased blood volume, right? Just increased volume of fluid associated with pregnancy. And then there's that risk of thrombocytopenia or the hypercoagulability state. Now, what if that patient already has a pre-existing medical condition such as hypertension or any cardiovascular risk before they got pregnant? So these are things that we really do want to watch. And then also the blood pressure will also shift and change during pregnancy too. So these are like little, you have to like kind of think of it as a whole picture as to what's going on and why we are drawing the labs we are. What are we looking for? Because that's what the mom needs to know. That's what we have to teach. So it's not just going in there, getting the lab work. It's why we're doing it. And we're doing it because of some physiological changes that are occurring within the body. And once we can adequately process what's going on in the body, then we can teach them. Right? We can teach them, well, you know, I want you to watch out for this because, you know, because of this pregnancy state, this causes this type of change. So these are all important, but it starts with us really understanding why we're doing what we're doing. Let's see, other key points. Again, it's the family setting and just being open to them and being supportive. With chapter 14. Chapter 15, we're going into the nutritional aspect. So, and just, we're going to discuss the total weight gain that's allowed during pregnancy. You cannot just eat, eat. This is very also concerning when you're dealing with adolescents because sometimes their diets are poor to begin with. So this, you do want to have like a balance and teaching them, which also becomes teaching the family about healthy choices, what to get, what to choose if you don't have access to a home cooked meal every day. We definitely want to be supportive there. And then we also want to discuss what to avoid during pregnancy, right? What we take in needs to be healthy and no alcohol or substance abuse. And substance abuse and alcohol use is a problem. You know, a lot of people feel stigmatized or judged by it, but we as nurses have to show that we are open and we are non-judgmental, and we will help you work through this. Because remember, the nutritional risks that are present during pregnancy. So if they are taking substances while pregnant, when they have the baby, we then have to take care of the baby who is possibly addicted to the same substances, right? And so that's important to think of what mom is doing while pregnant. Also the nutrition. So if we have a mom who's taking in a lot of diabetes, like a lot of sugar, then we are at risk for diabetes. And then we have a baby that's at risk for hypoglycemia. So that's very concerning. So we do want to make sure that the nutritional aspects are mentioned. We also need iron, right? Because again, we're going to go into this a little bit further, but when we have that the blood volume shifts and we have that dilution from the increased blood volume and the lack of red blood cells, the moms are at risk for anemia. We look at this throughout the pregnancy as well to see their risk, and when we note that they are at risk for anemia, we start implementing the intake of iron, which is very important. And it's pretty routine that all women will get placed on iron. And that is because of that physiological change that happens to all women during pregnancy. Let's see. What else is there for you guys that I think with our key points? Again, we will go through how much weight gain is appropriate and not appropriate. And again, we will discuss some of the complications from poor nutrition. So I hope that helps you. I hope that it gives you a little, preface to what we're about to do and what we're about to get into. I am excited about it. I look forward to teaching you guys, and please have your questions, ready for you to learn. Don't hesitate to, again, reach out to me. We're going to be covering chapters 13, 14, and 15 in class. And it's all about the care of the pregnant woman. So I will see you soon. Bye.